Hello and welcome to Breaking the Barriers, Reproductive Health in New South Wales, brought to you by the Youth Alliance for Sexual and Reproductive Rights. This episode is hosted by me, Laura O'Connor. Today we will be discussing access to contraception in New South Wales and the recent changes the New South Wales Government has implemented to address inequalities in access following the 2022-2023 Senate inquiry. Following this, we'll explore additional changes the Youth Alliance for Sexual and Reproductive Rights recommends to further overcome the barriers to sexual and reproductive healthcare in New South Wales. But first, let's begin with the Senate inquiry in 2022-2023. In September of 2022, the Senate referred an inquiry into universal access to reproductive healthcare to the Senate Community Affairs References Committee, and in May 2023, they released a report titled Ending the Postcode Lottery, addressing barriers to sexual, maternity and reproductive healthcare in Australia. The primary focus of the inquiry was to identify barriers to achieving the priorities under the National Women's Health Strategy, which is working towards providing women with options that empower choice and control in decision-making about their bodies. An issue of particular importance, as addressed by the strategy and the inquiry, are barriers women face in regards to the cost and accessibility of contraceptives. It is estimated 2 in 3 Australian women between the ages of 18 and 44 years old use some form of contraception, and due to the availability of various forms of female contraception compared to male contraception, women generally have a greater responsibility for their use. This carries with it a greater financial cost as well as health burdens, and there are numerous barriers that women encounter when attempting to access contraception in Australia. Some of these barriers include lack of community awareness of long-acting reversible contraceptives, high out-of-pocket costs, lack of resources or limited access due to geographical location, and no market options for male long-acting reversible contraceptives. To address these barriers, the inquiry provided the federal and state governments of a list of 11 recommendations. Some of these recommendations include enhancing the role of nurses and improving community awareness of long-acting reversible contraceptives, making contraceptives more affordable, addressing service gaps in rural and remote areas, and improving access to male contraceptive options. In February 2025, the Australian Government provided their response to the inquiry and either supported or in principle supported all 11 recommendations regarding the cost and access to contraceptives. In comparison, the New South Wales Government was much quicker to respond to the Senate inquiry. To address access barriers to contraceptives, the New South Wales Government implemented an oral contraceptive pill trial in September 2023. This trial allowed women who take the oral contraceptive pill to get a 12-month refill from a pharmacist, providing they had completed the requisite training, that is the pharmacist, without having to get a new script from their GP. This trial saw more than 500 pharmacies deliver over 2,000 consultations to women in New South Wales, and from September 2024, the trial was made permanent. As a result, women in New South Wales aged 18 to 35 years old who have been using the oral contraceptive pill for the last 2 years as prescribed by the GP or nurse practitioner are now able to access an extended supply for up to 12 months without having to visit their doctor for a prescription. In addition to this change in New South Wales, as of February this year, the Australian Government has pledged to invest $573.3 million to increase choice, lower costs and provide better healthcare for women. Of note from this investment is the listing of the new contraceptive pills on the Pharmaceutical Benefits Scheme. This is the first time in more than 30 years a new contraceptive pill has been listed on the PBS. In addition, the Australian Government will increase Medicare payments to GPs and nurse practitioners to provide bulk billed insertion and removal of IUD implants. This is expected to save approximately 300,000 women up to $400 in out-of-pocket costs when accessing long-acting reversible contraceptives. Whilst this is not a New South Wales-led initiative, women in New South Wales will benefit significantly from these changes. As stated by Dr. Whitburn, the Medical Director at Sexual Health Victoria, this is a step towards providing good, holistic sexual reproductive health, as once you remove barriers, there will be an increased uptake in sexual reproductive health care because people are provided with choice around their reproductive and sexual health. So, the Youth Alliance for Sexual and Reproductive Rights welcomes all changes that assist in overcoming the barriers faced by women when it comes to the cost and access to contraceptives in New South Wales. However, the New South Wales Government has failed to address most of the inquiry's recommendations, so we still have a long way to go to fully overcome the barriers faced by women when accessing contraceptives. To better address these barriers, the Youth Alliance proposes the following recommendations. Firstly, long-acting reversible contraception needs to become better accessible to support patient choice and access to highly effective forms of contraception. Long-acting reversible contraceptives such as IUDs and hormonal implants are 99% effective, have a long duration, and require minimal upkeep. However, the uptake of these contraceptives in Australia is low when compared to European nations, around 11% versus 10 to 32%. And when compared to the use of less effective contraception methods such as oral contraceptive pill and condoms. A reason for this low uptake is the accessibility of long-acting reversible contraceptives, and it is incredibly important to increase accessibility, as this would assist in the reduction of unintended pregnancies, which is a key focus of the National Women's Health Strategy, especially in rural and remote areas, where the burden of unintended pregnancies is greater than in urban areas. To support general access, it is crucial the nursing workforce is utilised. Currently, long-acting reversible contraceptives are generally provided by GPs in primary healthcare settings, and these services are less prevalent in rural and remote areas. Therefore, to generate better accessibility to long-acting reversible contraceptives, increasing the rate of nurse practitioners and midwives prescribing and dispensing long-acting reversible contraceptives is a readily available solution to this issue, and this would directly address recommendations 2, 3, 8 and 9 of the Senate Inquiry's report. Now, on to the second recommendation. So, whilst the New South Wales Government has made permanent the oral contraceptive pill trial, as discussed earlier, the Youth Alliance proposes this can be further expanded to better address barriers when it comes to access to contraception. It is widely held that women experience barriers such as medical appointment costs, time, and geographical challenges when it comes to the need for a prescription to access oral contraceptives, and that removing the need to visit a GP altogether for contraceptive prescriptions would simplify and increase access. In a study conducted by Danielle Mazza, it was found that participants felt direct pharmacy access would make obtaining contraception less intimidating, especially for teenagers, and many expressed that they should have the right to access contraception simply and conveniently to take control of their own sexual reproductive health. So whilst the new changes made by the New South Wales Government are a solid step forward, the role of the pharmacist can be increased and reliance on GPs for a script should be removed entirely. This would address recommendations 2, 3 and 4 of the inquiry's report. Thirdly, recommendation 10 of the inquiry report asserts service gaps in rural and remote areas should be addressed. This issue of access faced by women living in these areas can be overcome by utilising telehealth to deliver sexual reproductive health services. As asserted by scholar Sarah Wood, adequate access to healthcare benefits individual health as well as positively impacting population health. However, women in rural and remote areas are disproportionately affected by the lack of access to sexual and reproductive health services, which ultimately contributes to health inequities across their life course. To remedy this accessibility issue, rebates for telehealth consultations should be reintroduced. We saw with the COVID-19 pandemic that geographical barriers for women seeking healthcare services in Australia were briefly overcome by the introduction of Medicare rebates for GP telehealth consultations, specifically for the provision of sexual and reproductive healthcare. This provision increased accessibility, choice, and flexibility for women in their healthcare, and should therefore be reintroduced to address the barriers faced by women in rural and remote areas. Lastly, the Youth Alliance recommends there needs to be increased funding into the development of long-acting reversible male contraceptives, as asserted by recommendation 11 of the inquiry report. Long-acting reversible male contraceptives have been in development around 50 years. However, there are no male contraceptive products available for consumers, despite the willingness of males to use such contraceptives, ranging from about 34% to 82.3%. There have been increased advocacy in more recent years for the development of a male long-acting reversible contraceptive, with the Male Contraceptive Initiative being one advocacy group for the development of new methods of non-hormonal reversible male birth control in the pursuit of reproductive autonomy for all. The development in this area is consistently evolving, with Melbourne-based scientists recently solving the molecular structure of a hormone-free reversible male contraceptive pill, meaning this drug is hopefully close to becoming a reality. As stated by Dr. Ventura, an expert in male reproductive pharmacology at Monash University, there is a widespread perception that birth control is a woman's problem rather than a men's problem, and with increased funding in the development of male contraceptives, Dr. Ventura and the Youth Alliance for Sexual and Reproductive Rights hopes to change this. So now you're probably asking, but why is this important? Why should these changes even be made? Well, the answer is quite simple and lies in the foundations of feminist bioethics. By utilising a feminist perspective, we're able to analyse and recognise the harms and injustices faced by marginalised individuals that mainstream bioethics often fails to acknowledge. In this case, as the current legal framework stands, people in New South Wales, primarily women, face significant barriers to accessing contraceptives. As discussed, access to contraceptives is an integral part of an individual's sexual and reproductive health, and if we are able to address and remedy the barriers women face when accessing contraceptives, their overall health outcomes will improve, and women will be empowered through an abundance of choice and control in decision-making over their bodies. Now that wraps up today's episode, brought to you by the Youth Alliance for Sexual and Reproductive Rights. Thank you for listening.
¿Qué me pasó?